Hello Hipregnancy audiences. Today I'm going to discuss best tea for pregnancy. Stay with me till the end of this podcast so I can help you have a better pregnancy experience and give birth to a healthier baby. Is it safe to drink tea during pregnancy? The short answer to this question is yes, but it depends. Pregnant women need to limit their caffeine intake. The American College of Obstetricians and Gynecologists, ACOG, advises pregnant women to limit their caffeine intake to less than 200 milligrams per day. There are two types of teas, non-herbal teas and herbal teas. Non-herbal teas like black, green, and white teas are caffeinated options and must be taken in moderation. Herbal teas contain low caffeine levels, but some are safe for pregnant women and are the best food for pregnant women. As a result, pregnant women can drink tea during pregnancy, but they must choose options that are not high in caffeine and do not increase the risk of health problems for baby. We will mention the best tea for pregnancy and teas to avoid in the following parts of the article. So, keep reading until the end to get the answer to your questions about drinking tea while pregnant. How much caffeine does a cup of tea contain? As mentioned above, you must consume less than 200 milligrams of caffeine daily while pregnant. So, the best way to follow this rule is to limit caffeinated beverages like tea. The caffeine percentage in a cup of tea depends on factors like type of tea, preparation ways, size of the leaves, and water temperature. Approximately a cup of non-herbal tea contains 40 to 50 milligrams of caffeine. And herbal teas contain 0.4 milligrams of caffeine. As you see, herbal tea can be the best tea for pregnancy due to its low caffeine level. Benefits of drinking the best tea for pregnancy. If you choose safe teas during pregnancy, this beverage can benefit you and your baby. Safe teas have medicinal properties and help to have a better mood. In general, best tea for pregnancy help you to stay hydrated, help boost your immune system, reduces your anxiety and stress levels, reduce the risk of heart disease and cancer, relieve nausea, morning sickness, and vomiting, reduce labor complications and prepare the uterus for labor. Contains vitamins, antioxidants, amino acids, manganese, carbohydrates, potassium, etc. Five, best tea for pregnancy. Pregnant women need to be aware of their caffeine intake because baby's liver cannot break down a high amount of caffeine. So, you should be careful if you don't want to put your unborn baby at risk. Your caffeine intake should be less than 300 milligrams per day while pregnant. Herbal teas are the best choice to drink during 37 weeks of pregnancy. Herbal teas can help hydrate the body when women don't want to drink plain water, says Amelia Hirota, D.AC, a herbalist and acupuncturist at Phoenix Fertility Center in East Greenwich, Rhode Island. So, what tea is safe during pregnancy? The following teas are recommended as the best tea for pregnancy: chamomile tea. It is a great tea to drink for relaxing and relieving anxiety, but it should be taken in moderation. A large amount of chamomile tea can cause circulation problems in babies. Recommend you read on article Chamomile tea pregnancy. Peppermint tea. The most commonly used tea during pregnancy is peppermint tea. It isn't harmful for mom and baby and can relieve stomach cramps and heartburn in pregnant women. Consider that you should not drink it in the first trimester and large amounts in the trimesters because of its effects on menstruation. Ginger tea. It is the best choice for pregnant women to relieve vomiting, nausea, and morning sickness. It can also ease migraines and headaches, relieve stress, improve blood circulation, and boost immunity. But it should be taken in moderation. Raspberry leaf. Drinking raspberry leaf during the last trimester makes the labor shorter and prepares the uterus for birth. It is a good source of nutrients and antioxidants, makes the uterus strong, and prevents heavy bleeding after birth. Lemon balm tea. Pregnant women can drink this type of herbal tea to decrease insomnia and anxiety. Lemon balm tea can be a good choice for relaxation before sleep. You can drink caffeinated tea like black tea, but remember not to overdo it. If you don't want to put yourself at risk, try not to drink caffeinated beverages. What about green tea and black tea in pregnancy? These types of teas fall into the non-herbal teas category. They are caffeinated options and must be consumed in moderation. Otherwise, they can cause serious problems like a miscarriage. According to the Mayo Clinic, the average cup of black tea contains about 47 milligrams of caffeine, and a cup of green tea contains about 28 milligrams of caffeine. If you are a tea lover and like to drink these two types of tea, we recommend limiting your consumption. There is a trick to decaffeinate your favorite non-herbal teas. Just dip the leaves or bag in hot water for 30 seconds, dump the water, and refill your cup of tea with hot water. In this way, you can omit the high amounts of the caffeine because it is released within 25 seconds of dipping. Teas to avoid during pregnancy. As we mentioned above, there are some choices as the best tea for pregnancy. But some kinds of tea can be harmful to your baby and put you at risk of preterm and even miscarriage. The followings are some of the teas that can have risky side effects: pennyroyal tea, sage tea, fennel tea, black cohosh tea, licorice tea, motherwort tea, fenugreek tea, a large amount of chamomile tea, borage tea, vervain tea, thyme tea. It is better to consult your doctor or dietitian if you want to drink teas, even those known as the best tea for pregnant women, because each pregnancy is unique and has its circumstances. One of the best ways to ease morning sickness and nausea is to drink tea, but what is the best tea for pregnancy nausea? Here are some of the best teas for eliminating nausea, including peppermint tea, ginger tea, honey lemon tea, chamomile tea, fennel tea, licorice tea. Teas mentioned above improve digestive health and help relieve nausea and vomiting. They are also the best tea for pregnancy first trimester, except the first one. Peppermint tea may stimulate menstrual flow and should be avoided in the first trimester of pregnancy. It is good to know that you should also avoid drinking raspberry leaf tea in the first trimester since it may promote uterine contraction. To be safe, Hipregnancy recommends you consult your healthcare provider before including tea in your pregnancy diet, even the best tea for pregnancy, to prevent any possible dangers. Best fertility tea to get pregnant. Certain teas can boost fertility or increase your chances of getting pregnant. Fertility teas contain ingredients that help balance hormones and support your body during the reproduction cycle. These teas are a blend of different herbs, but nettle leaf, red raspberry leaf, and chasteberry are common ingredients in fertility teas. The followings are some best fertility teas to get pregnant, including Fairhaven Health Fertili Tea, Moontime Tea Organic Fertility Tea, Herbal Fertility Tea for Women, Traditional Medicinals Organic Healthy Cycle Tea, Sisterhood Hormone Balancing Tea, Secrets of Tea, Get Pregnant Fertility Tea, Modest Earth Baby Maker Tea, Yogi's Women's Raspberry Leaf Tea, Pink Stork Fertility Tea. Although most fertility teas are safe to drink, Hipregnancy recommends you consult your doctor before including this tea in your diet, especially when you take medications or have specific conditions. Thank you for listening to this podcast on Hipregnancy. I hope you enjoyed our deep dive into all the tips you can use to support a healthy pregnancy. If you have any ideas about the podcast, or there are any questions, share them with us via comment. Thanks again.